meantime, there's a ray of hope for cancer patients in Nigeria, considering how costly it is to treat the disease in the country. According to the Minister of Finance, Wale Edun, increased funding and sustainable healthcare systems will go a long way towards providing succor for cancer patients. The minister was speaking at a fund disbursement ceremony for cancer patients in Abuja.
Living with cancer can be a very challenging experience, as it takes a massive physical, psychological, and especially financial toll. This is confirmed at this gathering by victims battling different forms of cancer. Help is, however, coming their way, courtesy of the Medicaid Cancer Foundation's intervention in the form of a 100 million naira funding for their treatment.
Since I was diagnosed, in fact, through my life, the love and the care I've received for the past months was through Dr. Lawa, and the support. I've not received that kind of love and support from him.
Since you're now in National Hospital, I will personally ensure that you are enrolled on the Cancer Health Fund. A woman diagnosed with stage 2 breast cancer in Nigeria today, to get to a reasonable stage of cure, needs 25 million naira circa to cure her breast cancer or to get into remission.
According to the Minister of Finance and Coordinating Minister of the Economy, Wale Edun, it requires increased and sustained funding for the nation's healthcare system to beat cancer.
Everybody must come and play their part. The philanthropists, the individuals, the NGOs, as well as government and even international bodies. So I commend all the efforts of Medicaid Cancer Foundation and its whole ecosystem, its whole circle.
Some of the patients, including a male being treated for breast cancer, share their experiences.
Breast cancer can also affect a man. And with this little push of mine, and also having platforms like Medicaid, you know, being here, supporting us and making sure that we have hope.
I've lost a lot. Cancer is very toxic. I've lost money, I've lost relationships, I've lost a bit of my self-confidence sometimes, and you know, I'm more emotional these days, and of course I know sometimes I struggle with other mental health issues, panic, fear, anxiety, and all of that.
Cancer care authorities agree that more needs to be done in order to adequately address the challenge of providing the needed support for cancer patients.
In calling for a stronger health insurance system so that we can help to screen, have a national screening program that is fully funded and calls out women and men for the cancers we can screen for.
We're looking at opportunity of having funds to be able to cover all vulnerable people who will come down with cancer. So we have done this, and with the collaboration with you, partnership, we'll be able to let people also be aware.
And stakeholders say, while cancer treatment in Nigeria is very expensive, it requires concerted efforts from both the public and private sectors to give the much-needed support to victims of the scourge. Charles Eruka, Arise News.